Respected audience, this is Naushabe Khan, attorney at law, adjunct professor law. In our earlier parts of the topic, medical negligence, we have discussed different facets of the topic. And in the previous topic, we discussed the Bolam test. The Bolam test precisely highlights the importance of guidelines and a doctor's adherence to those guidelines while performing his duties that is considered as of key importance. And on the other hand, the Bolam test also highlights the importance of consent. So duty of care with regard to consent is also very important and that is discussed in a landmark judgment rendered by Honorable Supreme Court. And let me quote some of the facts from the case in hand, which resulted into the discussion that what is the importance of consent and what constitute the consent and what is the extent of consent if ascertained in a proper manner. In this example, a lady aged 42 years admitted in a healthcare establishment who had severe abdominal pain and she was about to get married. The doctor examines and diagnosed laparoscopic laparotomy. The mother and the patient gave consent. This is important that for this laparotomy, the mother and the patient, they both gave consent, and the consent was for the limited resection, and that was laparoscopic laparotomy. But what happened in this case? Uh, After obtaining consent, doctors started the operation. During said examination, the surgeon found uterus and ovary was required to be removed in order to save the life of the patient. So doctors got to know afterwards that if the life of the patient has to be saved, then uterus and ovary are required to be removed. Removal of these organs has incapacitated her to get married and give birth. So, once consent was to the limited extent, but during the course of examination and operation, doctors realized that in order to save the life of the patient, this is required to remove the uterus and ovary. So, since these two basic organs were removed, the lady became incapacitated to get married or to give birth to the baby. So, resultantly, the patient lodged a complaint against the doctor, and in this complaint, they have alleged that the consent given was to the extent of laparotomy, and that does not amount to consent for removal of uterus and ovary. Precisely, if the patient has given consent for diagnosis and investigation, you cannot extend it to intervention. So, this is the landmark judgment wherein the complaint was successful, and finally, Honorable Supreme Court held that the consent actually, this needs to be ascertained that what is the extent of the consent. In this case, it was simply to the extent of diagnosis and investigation, and that was laparotomy, whereas it was extended to the extent of removal of organs, which was never consented, neither the consent was solicited in a proper manner. So, these are the reasons that if the consent is not properly ascertained, this can hold a healthcare service provider guilty of gross medical negligence, which can entail the consequences of criminal negligence, and criminally doctor can be charged. It's not only the doctor but even the healthcare establishment in question can also taken to the task. So it is very important that whenever patient is presented, do take the consent and make sure that the consent is to the extent exercised, and it should not be beyond the given mandate. Have a blessed day. Thank you.